to do this, what we're gonna do, we're gonna shimmy this down just to where you can see the clavicle, okay? Then, realizing now this table's a little high. Then, what you're gonna do, just go ahead and take this and just drape it right over everything you're going to cover. If you're working somewhere that has specific requirements for your drapes, this ain't gonna work because they're not gonna like it. But for your own self, all you gotta do is just give that a little pull, and you literally are gonna shimmy all the way across. You can fold this up just enough to get it down, and then pull it up and cover what you need to cover. Then before you worry about any of this, I'm gonna go ahead and have you just barely open your arm a little bit and pinch that close for me. So. Then pull it taut.
Like a cute little crop top.
Little off the shoulder H&M.
Then set yourself a nice little flat fold drape right here. Go ahead, tuck down on each side.
You're color coordinated.
You look cute.
You are. You do look kind of cute laying there like that with your little floral breast drape.
You can get right there in the character reference.
Then I'm gonna. Then we're just gonna fold that up and make sure we can copy
This is
it.
the best medicine. I saw your belly moving.
See, there you go.
Yeah.
So, then just go ahead and palpate and get familiar with everything. I'm gonna warm my hands up.
You never keep the shirt on and just roll it up?
No.
Okay.
Because I'm gonna be working other stuff too.
Okay.
In North Carolina, breast tissue does not, like,
Does
it
not
applies
get
to
exposed.
everybody, right?
No.
No?
No.
Okay.
No, you can
Just-
undrape males for sure.
Okay.
Yeah.
They don't have that kind of language. It's female breast tissue.
It's female
Yeah.
breast tissue.
So
Okay.
first things first, get comfortable with the bottom layer here of all, or not the bottom layer, the bottom portion of the rib cage. So you want to know exactly where all that's at. So we got our border here, cupping up. Xiphoid process is right there. Same thing on this side. So this will be our target area. Now, for
I always pronounced it xiphoid. Have I been pronouncing
well,
it wrong the entire
I'm also
time?
not super great with some words too, so it might be xiphoid, but xiphoid, potato. And then, so we're gonna start with 5 to 7 minutes of abdominal stretching. We're not gonna do any skin rolling for the obvious, that would just feel weird. So, one of my favorite positions to start off with is I will take the blade of my hand and I will cup just where we showed you, where I was showing you earlier, that whole bottom of the rib cage. And what you'll do, just rest your hand and turn it. So you're going to pronate, and that will stretch right away. Take your other hand right below it, and you can stretch that opposite direction away from one another. And then you would just hold this because you got to target that abdominal aponeurosis. So we got one, and then you can do cross arm, or not cross arm, excuse me, staggered. So you'll stagger that away, and you can do that literally all the way down. And again, each of these are hold for a minute.
And you stop, like, just above the, like, ASIS?
Yeah, so what you're gonna see right here, we've got anterior superior iliac spine right there, and then we've got it right there. So
Okay.
that is good for us.
Okay.
Other than that, you're fine. The other way you can think about it is stretching away. So if you want to use an open palm, you can do that like so, or you can just come from this side, and this is going to help get all of those oblique attachments along those lower ribs. But again, that like prayer position almost, and then just opening your palm up, that'll give you a good stretch, and you don't have to do too terribly much to get a stretch on this stuff. So you would take your time, get all that opened up, loosen that up, hit that fascia first, and then we're gonna, I don't have any, and then we're gonna do some circular efforage, and basically what we were doing is we were stealing a lot of the moves from your TRO day, but we're just kind of changing the intent with how we're working with some of the intensity levels with this. So,
Can you show again how lateral you go with MFR?
oh, you can come all the way off to the rib cage through.
You'd want to catch the bottom part of those ribs, wouldn't you, to get the external oblique?
Yeah, and you can do a little bit of torquing if you prefer.
Okay.
So you can hit some torquing there.
Like
You can
where
go both
see the
ways.
Serrations of the obliques.
Yeah.
Could you make that the center of your?
Of the torque?
Yeah.
Yeah, you can do that. So all along through that line.
Okay, cool.
But it's literally, these are all the same principles from everything we've covered. So you're gonna get some more freedom as we're getting close to the end here. But just think about it, we've got tissue running this way, and this way. So you need to hit all of those different angles. For step number 2, we're going to continue warming them with circular effleurage 6 to 10 times from the bottom of the rib cage to the lowest part of the palpable abdomen. So these are going to be single pulls all the way around, just like so. But we're actually going to go ahead and put on some lotion to do that. And for ab work, I use a little bit more than I would normally in NMT, just to make sure we got a good glide. And the thing is don't be afraid to follow the bottom of that rib cage as you're coming around. Shift your hands if you need to and pull. Now, what direction are we not going to go?
Counterclockwise.
Counterclockwise, because that's not the way that the digestive tract works. So follow that clockwise form, go all the way around, and just cut and pull. And you're going to repeat this about 6 to 10 times.
And you're really just kind of stopping at the end of the rib cage on the other side.
Yeah. So once you get these warmed up, then you're going to go ahead and move on to number 3, which is utilizing stacked fingers. We're going to perform deep stripping to the rectus abdominis. It doesn't say half moon in there. Full moon. You can also do full moons with these, which is literally from your TRM day, where instead of just going one direction, you can go opposite directions with your hands. This feels really good too. Pressure-wise, how you doing, Rob?
Oh, that's great.
Okay. And you can just continue. You'll get this in a nice flowy pattern. And this is about the time you're going to start feeling some gurgles in their stomach. Don't let that freak you out. When it comes to step 3, so each individual strip. So palpate, close your eyes. This is when we're definitely closing your eyes. And then just kind of cross fiber strum to make sure you know right where the linea alba is. And we know it should be right here, but you need to feel that smoothness because it feels smooth compared to the vertical fibers of the rectus abdominis. Each individual square. So we know that that first one is going to be right about here. So we'll go up to that xiphoid, it'll come just across and down. Stacking your fingers, I'm going to hook right over top. You're going to compress very lightly on the ribcage, stack them, and you're going to go with the direction of the muscle fibers. As soon as you feel that smooth tendinous inscription, you're going to stop. And then you're just going to repeat your lines. You can see this is a really small move. I'm going to go in about 2-3 inches at a time. And you can work from lateral to medial and then medial to lateral or vice versa. But I'm usually going to hit this at least 6 times a square. So 3 lines twice.
Are you kind of starting like on top of the rib cage or just okay?
Starting on top, because that first one, you know, comes up a little bit high.
Yeah.
So right there's Rob's xiphoid. So it's going to come out and
Okay.
down.
Okay, that makes sense.
So you just lateral up the xiphoid?
Yeah, just lateral. I'm kind of hooking and pulling right at that curve below the sternum. And then once you've treated that one, always be feeling for little areas of tension. But I can feel my first tendinous inscription is right here because it's smooth. So now we're going to go below that. And I'm going to place my fingers right on top and continue that process all the way down. More or less pressure, you good where you're at?
I'll go with that.
Okay. The other thing is we're going to go slow. We're not doing any jostling type of movements, any shaking, anything like that, because you don't want to upset their stomach. And you just continue this process. I'm going to go ahead and move on another square. And when I get to the lower abdomen, because this is a place that adipose tissue can start building up, I will usually pull with one and strip inferiorly with the other. So we're going opposite. Okay. So I'm hooked. There's my tendinous inscription. Compressing in, moving inferior while pulling superior. So you're opening that up. And you're going to work just lateral to the umbilicus. Make sure your finger doesn't go into their belly button, because that has happened before. And then right here, I'm feeling a little bit of tension. So I'm just going to make a little mental note for that. And in number 3A. So as soon as we feel those, we can go ahead and stop. Let me know when you get to about mild tension, and this is not going to take a lot. Rob, how you doing?
Right about there.
Okay. So go ahead, and I'm going to have you take 3 deep breaths. Now here's the key. What you're going to see, See how Rob's actually using his abs? Make sure that their abdominal cavity is expanding. You might just notice that their chest is moving and nothing's happening down here. This is key because as you compress, it will open that tissue when they breathe and it pushes against your fingers. And I will do little small cross fiber friction as they inhale and exhale. You can also do linear friction as well, but you're not gonna move all that much. You will feel the pulse from the vena cava and the aorta, the aorta. That is okay. A lot of people you can actually see it on. And then on that 3rd to 6th breath, we're gently just gonna start coming on out of this. And then we're gonna pin again and go ahead and just strip that 2 or 3 more times right over that same little rectangular square that we were treating. Then that last little square, we're just gonna go down as far as we can. And the other technique that you can utilize too is that pulling up. So you can pin that tissue, pull the tissue up, and it works very similarly as if you're just stripping inferiorly. It's the same thing, and we're only gonna go down to right about there, because that's where we set our drape. This is definitely one where we are not doing any of the underneath the drape stuff at all, just to make sure that hard boundary is set.
Are there any other structures in this area that feel similar to what a trigger point feels like, or an area of tension?
If you've got adhesions, it'll feel like that. Areas of tension. If you have a potential hernia starting, then you might feel a little bit of some dense tissue there as it's trying to push through.
Would there be any risk for us causing a hernia?
I mean, if you're pushing real hard, you might, you'd have to be, I say this lightly, but you'd have to be pretty negligent to tear their abdominal wall. Like you're pushing really hard.
What about scar tissue from like laparoscopic surgery? Because like I have had 2 laparoscopic surgeries, and a couple of scars you could see, like they're very obvious, but a couple of them, like you would have no idea.
You probably have a little bit of adhesion is what that might feel like underneath the skin, especially if you can't see them, because there still will be a little bit of scar tissue from it.
Okay.
But yeah, that's all
It's gonna
fine.
feel
That's all
similar.
fine.
Okay.
Those deep friction works good on adhesions, and that's the case for anywhere in the body. Like slow, compressed, deep friction, a mild discomfort, it does really good to help loosen some of that up. Now, what I like to do, once I've treated one whole side, we would obviously go to the opposite, treat that, but to close out, the only full length strip that I'm gonna do is gonna be 3 times at the very end. You're literally just gonna strip all the way down. Hooking back in underneath that rib cage as we slowly go down. And then this is really just to make nice. I'm lightening up on every pass that we're doing here. And then I do a little, go ahead and knock out some circles before I'm gonna slide over here to the right side, or to right side, yeah. Okay. Now, working crossbody. So I'm gonna scoot through here. Working crossbody, stack fingers. We are going to do a pulling motion. So, to the obliques, dragging 6 to 10 times. As trigger points are located, we're going to do the same thing. Stop, treat, stacked fingers, mild discomfort, 3 to 6 breaths. So this feels really good. One thing as practitioner you need to watch out for is your back, okay? If your table's too high like this, or if it's too low, you're going to be noticing that you're leaning over too far. So try to squat down. Use the side of the table on your thigh to anchor you into a proper position, okay? And then you can stay upright and erect while you just gently pull and deep strip the obliques. Now what I'm doing is I'm reaching around to the posterior side, making sure that I've got on each individual rib, a finger on top of the rib, finger in between each one. So it's that same 3-stack movement that we did on the QL and erector spinator.
Is this on the, what ribs are you on right now?
All the lower ones.
Okay.
Yeah. Yeah, this gets serratus pretty good too, depending on how high you go up. Depending on breast tissue, how much of it that there is, you may or may not be able to hit serratus. That you're just gonna have to kind of play client by client.
And there's nowhere near enough pressure that you need to worry about the floating ribs.
No, yeah, don't dig your fingers into that floating rib, which you can, because if you reach around too far, too inferior, and you're coming back across, it doesn't feel super great. You can go over top of it, but you're not gonna curl into it, so to speak. Just gentle pulls, gentle but firm. And if you found any areas of tension, stop, treat them, breathe, just like practice. Then, this one, not everyone loves. So I'm gonna go back over to this side because this is the side we're really focusing on. So the deep friction to the bottom portion of the rib cage. So I'm gonna put a little bit more lotion on just to make this flow right. So I'm gonna start just lateral to the xiphoid process. I'm gonna stand kind of at an angle and I'm gonna hook in right to that rib cage on those attachments. And I'm gonna cross fiber friction. This is the definition of gentle but firm. Really small movements. I'll usually move up with their inhale and down with their exhale. The other key thing that you're going to want to be watching the whole time is that your client's breathing. This is another one of those areas of the body where if you're breathing with their breath, works pretty good for you.
So you're shooting for transverse abdominis at that point?
Right here?
Mm-hmm. Is what-
Yeah, we're hitting, well, you're going to get some of that attachment side work from this, but you're getting some of the obliques as well.
Okay. So if you get that like stomach cramp right at the xiphoid process, it's probably coming from the external obliques. It's
Could
like
be,
trying to
yeah.
build like that right into the
Is that what you're getting right now?
No, but I've had it, and that's where, you know, it's just
And I will say, the more lateral you go, the more tender this is going to get. So I'm lightening up pressure a little bit as I move each step laterally. And then we're going to go ahead and stop right there, because if I go any further and I hook in, we're going to get back in there in that floating rib. So leave that be. Once you've done your friction through there, you can friction inferior to the xiphoid process, just don't push into it. If you want to get that, because we know that that rectus abdominis connects right here, rest your fingers on the xiphoid process, traction inferiorly, and then gently compress in. And then cross fiber. Not inferior, superior. Because then if you go superior, you're going to run right into that. Your fingers right into the xiphoid. Then, repeat steps 2, only 3 to 5 passes, so that's that same thing. We're going to come back on through. Hit them with some half moons, full moons, new moons. I don't know anymore.
Waxing, waning.
Crescent.
Goodbye.
Mercury's in retrograde.
Pluto's,
I think it's
Pluto's
Venus.
coming back.
Venus
God,
thing.
I shouldn't even have said anything.
19th.
And then that's
think so.
that's
Venus
it
retrograde right
for
now.
this on today, okay? Because this same thing is gonna, the other 7 through 11 are psoas and diaphragm. You have to do this work
In order to get to
until
that.
you get competent with using your elbow. You really got to work all this stuff before you can get down to psoas. At this point, I just do slow, deep compression with my elbow. I don't even fool with the abdomen anymore, and I can get down there 99% of the time.
So we stop at step 7 today.
Yes, you don't do step 7. You stop at 6.
So if we were to get abs for your traction, we would, this would be exactly what we would do.
Yes.
And then if you were to get psoas, we would do abs.
I wouldn't
and
give
psoas.
you psoas because you'd have to do 2 technically
Okay.
to do it appropriately.